10 things to watch for during hospitalization. Watch this video first if you or your loved one is in the hospital. It will provide you a heads up about things to expect and help make a smoother experience. Hello, let us talk about what to expect during hospitalization. Nobody ever wants to be in hospital, but we all have to face it at some point. In this video, I will give you a quick overview of what to expect when you're admitted into the hospital so that you can navigate this difficult time easily. You can prevent most hospitalizations by taking care of yourself. Most chronic diseases that lead to hospitalization have been brewing for a long time. Lack of exercise, improper diet, inadequate sleep, smoking, alcohol, and mismanagement of stress is the most common risk factor. These risk factors lead to the most common diseases like hypertension, high cholesterol, diabetes, chronic obstructive lung disease, heart disease, stroke, and cancers. Hospitalization affects all 5 domains of your life. Your body will go through a lot of pain and suffering due to illness and different treatments. It is emotionally taxing, and it isn't easy to think clearly and make rational decisions. Your spiritual faith gets tested, and you question everything. It also weighs heavily on your family and friends. It can financially ruin you. Medical bills are the #1 reason for filing bankruptcy in the United States. Hospitals are a very complex environment, consisting of healthcare providers and support staff with different skills level who will make life-altering decisions. Healthcare technology is getting increasingly sophisticated and complicated. Medication adverse events are one of the significant sources of complications. Please watch for following 10 things during hospitalization. 1. You will be assigned an attending physician who will be your main doctor during hospitalization. The hospitalist will coordinate your care with other specialists and a supportive teams, including a pharmacist, social worker, case managers, and physical therapists. You will have an assigned nurse per shift. Nurses are the backbone of the healthcare delivery model. She is the one who provides care, and our nurses do a great job. Be courteous to them. You get more flies with honey than vinegar. They are the eyes and ears on the ground all the time. 2. It is prudent always to carry accurate information to your hospital doctors so they can make the best decision. Always identify your primary care physician to the hospital staff. Take your medication list with you. You can provide most of your history by accessing the patient portal. You must have clear advance directives about your healthcare surrogate, living will, and organ donation. Ask questions if you need help understanding something. You have rights as a patient. You have the right to information about your diagnosis, treatment, prognosis, medical records. There is a lot of information available on the internet about your hospital from reputable resources. You will face 6 different kinds of activities in the hospital. Laboratory studies, radiology studies, including X-rays, ultrasound, CAT scans, MRI, procedures like angiograms, surgeries, and endoscopies. Medications. The medication pose is the maximum risk. Specialist consults, ancillary services including physical therapists, care managers, and social workers who will help you have a smooth home transition. You have the right to know about the different treatment options and accept or refuse the treatment. 3. Allow yourself time to heal both physically and emotionally. Pay attention to proper nutrition, sleep, and rest. Your hospital staff will ensure your comfort. Get up and walk around as much as possible. Early activity will help prevent blood clots and improve circulation and bed sores. Be safe. Please call and not fall. 4. Every hospital has a chaplain to provide you with spiritual support. You can have access to the spiritual help of your faith. 5. Keep your family and friends informed. It is excruciating for them, and your nurses and doctors can keep them informed and calm. Please request them to honor hospital visitation timings and policy. 6. Make sure you understand your medication dosages and schedules. Medication adverse events are prevalent. 7. Beware of hospital-acquired infections, especially if you have urinary catheters, central lines, or big drains. 8. You will receive a lot of information about your diagnosis, medication, and procedure. Please educate yourself. 9. Stay positive. Hospitalization can be scary, but it's also an opportunity to improve and change yourself for the rest of your life. 10. Follow discharge instructions carefully. Know about the changes in your medication, get copies of your records, and establish an online account to access hospital records. Ensure to call your PCP immediately. An excellent primary care office will contact you proactively. Most hospital case managers will call your primary care to set up follow-up appointment. At Shield Medical Group, our transition of care team will contact you to do need analysis. They will ensure that you have all necessary medications. Our health coach and referral coordinator will make sure other services like durable medical equipment or home health care if needed. They will set up a follow-up within 3 days of your discharge. At Shield Medical Group, we will set up follow-up on 7th day and 30th day from discharge to ensure continuity of care.